psychiatrist, and basically today we're just going to be going over your medical and your psychiatric history so we can hopefully form a really good treatment program for you. Does that sound good for you?
That sounds good.
Okay, good. Let's start out with your medical history. Can you tell me if you've had any surgeries in the past?
Well, let's see. When I was real young, 2 years old, I had a rare syndrome called Stevens-Johnson syndrome.
Oh.
Not much known about it even today, but I had rashes all over my body.
Okay.
And wasn't supposed to actually make it, but I did.
Wow.
So I didn't have any surgeries, but it was quite a profound thing in my life. And then when I was 18, I was in a car accident and I fractured my jaw in 3 places, and I had to have an operation to put it back in place, and it was wired shut. And at 21, I had my wisdom teeth out.
Okay.
And let's see, 43 years old, I had a hysterectomy because I had a lot of cysts and fibroids and heavy bleeding, so they had to take my uterus and ovaries out.
Okay. And have you had any children in the past?
I have 2 children.
Okay, 2 children. Were there any complications with the pregnancies?
No complications at all.
Okay, good. And then, is there anything else that you think that I should know medically about your past?
I do have high blood pressure and high cholesterol, and I also have been having kidney stones for the past 10 years. And last year I had one that was so big and so bad that I was hospitalized for like 6 days, and they had to put a stent in and they had to blast it because it was so large.
How long ago did you say that was?
Probably about 6 months ago.
Okay, 6 months ago. And since then, you haven't been experiencing any other pain from your kidneys?
I've had a couple of bouts of pain, but I passed small stones on my own. So.
And are you on any medication at the time for any of that?
I am on a blood pressure medication for pranolol.
Okay.
And I'm on a cholesterol lowering medication called Crestor.
Okay.
And I just take pain medications that my urologist gives me when I'm having a lot of pain with my kidney stones.
Okay, and those are working fine for you, keeping you stable?
Yes.
Okay.
Last week I had a physical exam and my blood pressure was actually excellent, and my cholesterol came back in the normal range.
Great, great. And is there anything else that you want to tell me about? How are you feeling right now? Any concerns right now?
Well, that's actually why I came in. My medical doctor recommended that I come see a psychiatrist because about 10 years ago I started having a lot of panic attacks and a lot of anxiety, and he put me on a medication, and then about 5 years after that I started getting really depressed.
Okay.
So over the past 6 months I've been feeling really, really bad.
Okay, and what medications did your previous doctor put you on?
He had me on Paxil 20 milligrams.
Okay.
To begin with, I was on that for about 5 years, and then he increased it to 40 when I started getting the depression.
Okay.
And it helped, not fully, but it helped me live a halfway normal life. But over the past 6 to 8 months, I've just been so depressed that I don't even want to leave my house.
Okay, and you've never been on any other medications besides the Paxil? You just stuck with the Paxil all that time?
Yes.
Okay, great. And I think because you have been on the Paxil for so long, 10 years you said, that probably you've grown a tolerance to that medication by now. And there are so many other medications on the market right now that are exactly like a Paxil, antidepressants that are great. We can try to switch you to a different antidepressant. I think that at this point that's our best option, to switch you to something new, and we can add in a low dosage of an antidepressant too to help with your panic attacks and your anxiety. Does that sound like something that might be good for you?
Sounds like a good idea, yeah.
Okay, yeah. But I think that would definitely help you out if we switch you. Do you have any concerns about that?
I'm a little afraid to go off the Paxil because I've been on it for so long.
Okay, that is a big concern for a lot of my patients, is that they've been on the Paxil, well, they've been on the medication for so long, they're afraid to get the withdrawal symptoms, and I can assure you that if we wean you off very slowly and carefully, you will not have very many to no side effects at all doing it this way.
Okay.
Does that sound
and you've weaned people off of Paxil before?
Many times, yep.
Okay.
Yep, and I think these new medications I'll put you on will help get you through that too. And then you should start feeling better very soon, and an uplift in your mood and your spirits.
Okay.
Does that sound good?
Yeah.
And then also, I know you said that your doctor mentioned therapy in the past, or have you ever done therapy in the past?
My doctor mentioned therapy, and he mentions it actually every time I see him, and I'm always afraid to go, and just talking to a stranger just kind of seems scary to me. So
a lot of people think that talking to a therapist is scary, but I can assure you that a lot of people really benefit from the therapy, talking to someone, plus getting the right medications in their system. It's very beneficial to a lot of people, and sometimes just people don't get to talk to someone about their problems that actually understand what they're going through, and we have a lot of therapists in our office that can understand what you're going through and help you out, talk you through things. If that sounds like something that you'd be interested in, we can set you up with something like that.
I think that's probably a really good idea. I mean, over the past 6 months or so, I feel like I'm slipping away from my family because they just don't understand, and I think they really think that I'm making these symptoms up, and so if I have somebody to talk to about it, maybe it'll make me feel better.
I'm sorry that you're going through that. I really think it would benefit you to talk to someone that understands, and we have a therapist in our office that specialized in anxiety disorders, so she'd be probably very beneficial to you.
Oh, that sounds perfect.
Yes, and I know you said that you had 2 children.
2 children.
They've noticed a change in your mood, obviously.
Yeah, I used to be really happy and fun, and they said that I just don't want to do anything anymore, and I never smile, and I just don't have any excitement in me.
Are you working right now or doing any activities that you enjoy doing?
No, I stopped working about 8 months ago because of the anxiety. I couldn't do it. I just didn't want to leave my house.
You just don't have the motivation and okay, I think that these medications are going to help you a lot with those feelings. So we'll get those prescriptions written up for you.
Okay.
I'll do that right now for you. And then, like I said, we will be switching your Paxil from 40 milligrams, you said it was?
Yes.
Yeah, now? So we'll switch them from 40 to 20 milligrams. And then we'll add on the depression medicine and the anxiety medicine for you. And then here is that.
Thank you.
And then the front desk is going to set you up with an appointment for me. And I'm thinking the best time, I think we'll meet in 2 weeks so that we can talk about the medication and how it's doing for you. And if you don't like anything about it, we can switch you to something else. We just might have to continue to tweak things until you really like the way that you're feeling.
Okay, if I'm feeling funny or anything like that, I can call the office?
Oh yeah, feel free to call at any time. They'll even give you my cell phone number. If I'm not there, you can reach me. If you have any questions or concerns, I'm there for you.
Okay, so I'll make an appointment to see the therapist, and I'll see you in 2 weeks?
Yep, the front desk will set you up with the therapist as well.
Okay, great.
All right, very nice meeting you, Susan.
Thank you so much.
I hope that we can help you.
Thank you so much.
Okay, goodbye.
Bye.